challenge has been the systems were proprietary, right, and unable to share data. That hurdle is somewhat being overcome right now. The vendor community is actively participating in this. The federal agencies are active in building interoperable, open specifications and so on. The second area will be to look at the infrastructure for sharing data nationwide. What does that mean? We are moving into a world of Facebook and so on. So, but at the same time, when you talk about health information, there is the need for security and privacy, because people normally try to compare, saying, you know what, my banks are connected, using that as an example.
Sure.
At the same time, health is much more complicated, and the privacy and security needed is I would rate it more than the other areas. If you look at what the federal systems, where it is today, as you know, the Federal Information Security Management Act is required, which is a high level of security controls. We say somewhere around 170 controls required for that. And on the private side, the expectation is the entities, participating entities, have HIPAA implemented.
Right.
It's approximately around 70 different controls, right? So see a difference of 100 controls between the federal and the private. Now the challenge is, how do you move information from a tighter one, like the federal systems, which is to a less number of controls in the private side. So how do you set that kind of, makes a decision where the federal community is comfortable sharing the information with the private sector? So there are discussions going on right now among the federal agencies on how do you do some level of harmonization where you have the domains are much more harmonized, so the information can flow. Because when FISMA was written, it was very much for protecting federal data, right? There was no discussion at that time about health information exchange. And now that is in front of us, and we'll have to figure out how we're going to. As you know, we are going through what we call the meaningful use activities within the federal government, within the Office of the National Coordinator. There is a lot of lessons that entities like DOD, VA, IHS, who have been doing this for a long time, right? Using IT to improve care. And entities like CDC and others in the federal government, from a population health perspective, there are a lot of lessons learned that we can reuse in the way we are working out the transformation in the nation. So a lot of lessons learned can be shared with the private sector. Yeah.